Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician, associate, and health educator here. So, today's topic is nurses and other medical staff who are making the decision to not get vaccinated and actually leave their jobs instead of getting vaccinated. And I wanted to just talk briefly about that, in particular to nurses. My mother was a nurse for 43 years. I was a certified nursing assistant for 8 years. I was in nursing school trying to get my RN. And, before I finished my bachelor's and went to PA school. But I just wanted to talk about how I kind of see how nurses are being treated in the media, just from my perspective. They were hailed as heroes at the beginning of the COVID pandemic. Even I think it was Marvel did a comic book on nurses. But now that many of them, not most, but a good number, a significant number of them are choosing not to be vaccinated because of what they feel are potential side effects, both short-term and long-term, and what they feel has been presented as a paucity of research. And they're not willing to take that risk. And for some, it's just the principle of the matter of being made to put something into your body. What I've kind of seen is many people with more advanced degrees, like PhDs and doctors, like one doctor in particular, saying, well, we want to first thank our brave nurses for, treating our COVID patients. But these nurses that are not, choosing not to get vaccinated, putting the public at risk and their patients at risk, I'm paraphrasing. He said something to the effect that nurses really lack the advanced medical knowledge to understand what side effects, what constitutes side effects, and they don't really understand the science behind the vaccines and immunology. And I thought it was kind of insulting, just from my perspective, insulting and condescending to the nurses. I mean, again, as somebody who as an erstwhile nursing student, we had biochemistry, at least where I went to school. So biochemistry, immunology, pathophysiology, anatomy and physiology, microbiology, and cell biology, some other courses. This was in the nursing school where I went. So that's going to give you, a little more than that's going to give you more than just a rudimentary understanding of vaccines and side effects and how they work in the body. And now everybody is privy to other people's research. So even the folks who are PhDs who actually do vaccine development are actually virologists and immunologists. With the internet, anybody can Google this stuff. And then if you live in a certain area, I live near NIH, maybe some of you all live near the CDC, you can actually talk to people who are involved in that research. And I just found it curious that one of the main people who are not getting vaccinated are folks with PhDs. I thought that was an interesting observation of this vaccine hesitancy. But as far as other clinical staff is concerned, again, specifically to nurses, I just want to know what you guys think. Do you think that they've gone from hero to zero in many ways? And there was when I was a younger person and I was majoring in nursing, part of me that was bothered about the prospect of becoming a nurse was how nurses are perceived. There's this kind of stereotype of nurse ratchet, you know, who's kind of an administrative, strict nurse, usually a middle-aged woman. Then there's the sexualization of the nursing image. You know, the hot nurse, buxom nurse who's there to give the guy his digital rectal exam or something with you know, very erotic stuff. I mean, it's even part of a fetish. And then another negative stereotype, I think, with, you know, the kind of quote-unquote flamey gay nurse. I've seen that in you know, TV dramas. I don't think that's respectful. But I think that was part of the thing that dissuaded me from pursuing nurse. Granted, I was in my early 20s. I've matured since then. I think nursing is an awesome profession. I work with a lot of outstanding nurses. A lot of them are guys. But I think nursing knowledge has got to be respected. You know, the sacrifices that it takes to become a nurse. Maybe I should have done this for Nurses Week. But I also can see how the media can really affect how a certain group of people are perceived. And in this case, it's nurses. A lot of doctors are not getting the vaccine also. Or I should say a good number, a significant number of them. But anyway, what do you guys think about this? Are nurses nurses that choose not to get the vaccine, is their nursing knowledge not being respected? And who's at fault? Is it the nursing community or is it just the media? Please be polite to me and each other in the comments section. All right. Whew, okay. You guys, if you want to reach out to me and want information on how to become a physician assistant or a health educator or anything else in the health education or the allied health field, I've been doing this for about 30 years now, and I can hopefully give you some good advice that is useful to you. Take care. I wish you guys the best of success in your positive endeavors. Peace. Oh, God. These weights are heavy. Good morning.